topic of my video is difference between MRCP UK PACES and MRCP Ireland General Medicine Clinical. In this video, I have mentioned all the major differences, which will answer all the questions that have been asked in my DMs on the Instagram page. So, MRCP UK PACES and MRCP Irish Clinical. First, I will discuss about the fee. The PACES exam has a fee of £657 to £690 when taken in the UK, while if you take the exam internationally, the fee is around £1,278. Irish Clinical has €845 of the fee when taken in Ireland, and if taken internationally, then it is €1,460. About the eligibility criteria, the MRCP UK PACES can be taken after you pass your MRCP 1. It has been mentioned on the website that when you have passed your MRCP 1 UK, you can either get the MRCP 2 UK written or PACES. It is your choice. However, students always prefer to take the written exam prior to taking the clinical exam. Apart from this, on the website, it is mentioned that it is advisable to have any clinical experience or training, but it is not mandatory to have a training to appear in the MRCP UK PACES. This has been asked by so many students in the DM that do we need training to appear in the MRCP UK PACES? The answer is no. You need some clinical experience, you need some work experience, that's all. And the eligibility criteria for the MRCP Ireland Clinical is that you have passed the MRCP Ireland General Medicine Part 2 written in the last 3 years. If that time period has passed, you have to retake the exam in order to be eligible for the clinical exam. There is a huge list of exam centers for the UK PACES. You can take the exam in UK or in many countries, including Pakistan. And for the Irish Clinical, you can take the exam in Ireland, or you can take the exam in Malaysia, Oman, Saudi Arabia, Dubai, and Malaysia. There is no center for the clinical exam of the MRCP Ireland in Pakistan. The exam format for the PACES exam and the Irish clinical exam is more or less the same now. Previously, it was different for the PACES, but now the exam pattern has changed in the past year. So in the UK PACES exam, you have 5 stations overall. There is a 5-minute interval between each station, and each station is of 20 minutes. I have written these stations, how they are going to be present. Station 1 is communication, that is going to be of 10 minutes, and after that there will be respiratory, that will be of 10 minutes, in which there will be a 6-minute performance and a 4 minutes viva. There is no viva in the communication station. Station 2 is a long case, or you call it the brief clinical consultation, in which you will be given a scenario and you will be given obviously 5 minutes to interpret your whole scheme, and after that you will be given 15 minutes to take the history and examination, and after that 5 minutes will be for the examiner to take viva. Next is the cardio and neuro, same as respiratory. 6 minutes you will perform the examination and 4 minutes will be viva. Station 4 is communication again, but there is no viva. You will be discussing your scenario with the patient or the surrogate, that's all. And 10 minutes will be of abdomen, in which you will be given 6 minutes for examination and 4 minutes for viva. The station 5 is the same as station 2. So this is the whole pattern of the PACES exam. The MRCP Irish Clinical is a little different, but more or less the components are same. There is only one communication skill station. So the exam format is, there are total 5 short stations, in which there is a communication skill station included. There's a 10 minutes given for each station, and there's a 2-minute interval in between. Station 1 is respiratory or cardio. Station 2 is endo. Sorry about that. Station 2 is endo, or any other topic can be present like derma. Station 3 is neuro or locomotor. In my exam, there was no neuro station. There was a case of psoriatic arthritis, and there were psoriatic patches, and the patient also had signs of arthritis. So locomotor can be present in your exam. Next, abdomen is a whole complete station, so you need to prepare that very well. And next is communication skill, in which you will be given 6 minutes to talk to the patient, and 4 minutes will be a viva with the examiner. And after that, when all your 5 short cases are completed, then you will be giving your long cases that are 25 minutes each with a 2-minute interval. So I will be now discussing each individual station what are the differences between the both exams? In the MRCP UK basis, in the communication station, you are given 10 minutes to talk to the surrogate or the patient. There is no viva, and there are two stations of communication skills. In the MRCP Ireland Clinical, there is only one station. There are 6 minutes and a 4-minute viva. In both the scenarios, in both exams, you will be given a scenario outside and you will be given time to interpret your whole scheme, what you are going to talk to the patient about and what is your agenda. So you will be given around 1 to 2 minutes for that. So basic clinical consultation or long case in the UK exam and the Irish clinical, there are two long cases. So one major difference is in the UK cases, when you are given the 5-minute interval, there is a scenario written outside which you can read, you can interpret, you can set up your history according to it, and you can make up your mind what you're going to examine about the patient. However, in the Irish clinical, there is no scenario given outside. You will be sitting there waiting for your turn, and when the bell rings, you will go inside. And even then, the examiner will just talk to the patient, or he or she will just give a single line complaint that this patient came with the shortness of breath. Please proceed. That's all. There is a timing difference. Like PACE's clinical consultation is of 20 minutes. In the Irish, there are 25 minutes. And one more difference is in the PACES exam, there is always a patient that will be present in the long case, and there will always be some physical signs that you will be identifying from the patient. Like there will be signs present and you need to pick them up. However, in the Irish clinical, it is written on their website. It is written and mentioned on their website that post-COVID, there is not usually a patient in the long case. They usually keep a surrogate, and they expect you to know what findings might be present in the patient, but there will be no findings. So there is no marking for the identifying of the physical signs in the long case of the Irish clinical. Okay, so next we have the short cases. In both the exams, there are four short cases each. The timing is the same. There will be 10 minutes given for each short case. There will be a 6-minute examination and 4 minutes of viva. However, the basic distribution of the stations in the PACES exam and Irish clinical is a little bit different. In the PACES exam, there will always be a respiratory station and there will always be a cardiology station. However, in the Irish exam, there is only one station which can either be respiratory or cardio. So in other way, you have to prepare both these stations, but there will be only present one in your Irish exam. Next, there is an abdomen station in both. And fourth station for the PACES exam, there is neuro or locomotor, or there might be a dermatology station, but usually there is neurology. However, in the Irish clinical, there is another station specified for the endo or miscellaneous, and also the neuro is divided with locomotor. You can either get neuro station or locomotor and endo or miscellaneous. So there are some other points which I want to add up in this video, which was asked in my DMs. Yes, these scenarios are mentioned in the PACES exam. There are no scenarios for the long or short case except for communication. When you are sitting outside, you don't know what is inside the room. I was sitting, it was my first station. I did not know what was it. Either it was cardiology or they might sometimes mention on the door that this is cardiology, that's all, or respiratory. But in my exam, there was nothing mentioned on the door. I went inside and there was a one-line scenario. This patient presented with shortness of breath and the examiner asked me to do the cardiology examination. Otherwise, there was no scenario mentioned like shortness of breath with pedal edema or irregular heartbeat. There was nothing mentioned like that. However, in the PACES, there is usually a 1 or 2 line scenario so that you can make up your mind that this is a neurology station or either an association with the disease. Like if the patient is having a stroke and the case is respiratory, then you can judge with the scenario that this might be bronchiectasis due to aspiration pneumonia. So these are the some clues that are usually present in the PACES exam, which are not present in the clinical exam of the Irish. And next is mixed up clinical cases in the UK PACES exam, because there is not a sequence. You are giving communication skill, then there is another short case, then there is a long case, then there is a short case. So this is a little bit of mixed up scenario. However, in the Irish clinical, this was a good thing that there were two groups. First group went for the short cases plus communication, and then the other group was there for the long cases. Next is the fundoscopy. I did not know till my exam day that there is no fundoscopy in the Irish clinical exam. I even went to the hospitals to look for the retinopathy and hypertensive changes on fundoscopy, but there was no fundoscopy in clinical of the Irish exam, and there is usually not present uh, in the Irish exam. However, in the PACES, there can be even a station for the fundoscopy, so do prepare well if you're taking the PACES exam. Next, one more thing very important is that in the PACES exam, you are given instruments at the spot. Like if there is a short case and you go inside and you see a clinical hammer and a tuning fork. So these are these little clues that make you judge that this might be a neurology station. This is also a helpful thing in the PACES exam. This is also a helpful thing in the PACES exam because at that time you are so anxious and panicked and you don't remember taking all your things from one room to the other. However, in the Irish clinical, you have to put all your stuff in a plastic bag, which can be provided by the management at that time. You have to put all your stuff in it and then you have to take it from room to room. So this was one more major difference in the clinical exam. So I guess I have mentioned all the differences and I hope that this video was useful. Please do subscribe to my channel. Thank you.